Steward Health Care is deep in debt, putting the future of its 9 Massachusetts hospitals at risk. And as the flailing company shirks its financial obligations on several fronts, GBH News' Jeremy Siegel reports that community nonprofits connected to Steward are also taking a big hit. And he joins me now with more. Jeremy, good to see you. Thanks for being here.
Thanks for having me on, Adam.
How'd you find out that this is happening?
This came through GBH's community outreach efforts. Over the past couple years, we've really intentionally set out to talk to people who live in the communities around us and our neighbors here in Allston-Brighton. And someone who works for an organization, the Allston-Brighton Health Collaborative, reached out to us saying that Steward Health Care owed them a bunch of money. So after they reached out, I said, this is interesting. We're going to look more into it. And what we found is that Steward Health Care owed this organization $50,000 of $150,000 that it promised to pay for a program that serves low-income residents of Allston-Brighton at the Brighton Farmers Market to get coupons to help them get healthy meals and free food, essentially, to bring home to their families.
These are the veggie vouchers, right?
They're veggie vouchers,
That's the moniker for it. And that's a program run by the Allston-Brighton Health Collaborative?
It's run by the Allston-Brighton Health Collaborative, Steward Health Care, or St. Elizabeth's Hospital, rather, which is owned by Steward Health Care, the largest private physician-owned healthcare system in the country, which owns 9 hospitals in Massachusetts. It promised to provide all of the funding for this program.
$50,000 a year for 3 years, and none of that's been paid.
Exactly.
What are the other organizations that have not gotten money that Steward had committed to giving them? Because there's a few.
There's several of them. After the Allston-Brighton Health Collaborative reached out to us and we found out about their situation, I began reaching out to other groups and uncovering the fact that Steward Health Care, St. Elizabeth's Hospital, they promised to pay more than $600,000 over the past few years. That community funding has essentially become nothing. And community advocates who I've spoken to, the heads of nonprofits, say that this has all happened since Steward Health took over St. Elizabeth's. This is a hospital that's been around for decades and decades and decades, a pillar of the community. It was bought by a for-profit place, and essentially in the decades since then, they've noticed a complete retraction from community support.
I want to mention a couple other organizations. Allston-Brighton Pauses, which is a substance abuse or runs substance abuse programs. The Coalition of Racial Equity and Mental Health, which gives scholarships, not totally a ton, I think like $15,000 annually of scholarships for people who are living in the area and getting degrees. You looked at emails that went back and forth between the Allston-Brighton Health Collaborative and the leadership of St. Elizabeth's Hospital. What was the texture of those exchanges as St. Elizabeth's refused to or failed to deliver on these commitments?
It was fascinating to read these emails because we've all heard so much about the dire situation financially that Steward Health Care is in, but this gave a real glimpse into how it's affecting people's interactions with each other, especially when it comes to money. So I had emails that I reviewed that showed the Allston-Brighton Health Collaborative reaching out to St. Elizabeth's Hospital saying, hey, thank you so much for providing this grant money to run this veggie voucher program. We haven't received a check yet. What's going on with that? The hospital got back to them saying, we're going to pay you for that. They brought it up the chain as they continued to not hear back.
In a very kind of sunny, don't worry about it, right? Oh, yeah, like this money's
coming,
flying out the door any day now.
There were emails with Paul C. Smith, who is the president of St. Elizabeth's Hospital, also with the CFO of St. Elizabeth's Hospital. Each of them literally says the check is on the way.
Yeah.
We're writing this now. It's going to be coming. And a month would go by. They would reach back out again. The check was still never there. And then eventually, the hospital stopped responding to them entirely. And that's when they decided we should reach out to GBH so they can figure out what's happening here.
It's probably worth noting that St. Elizabeth's did not say it was going to provide this funding for good deeds, good programs. They didn't do it out of the goodness of their heart, right? They did it because they wanted to build a new garage on their hospital campus. And tell me if I'm getting this correct, the city of Boston basically required that they provide community benefits in exchange for the right to build.
Exactly. Anytime that there's a huge development, the city requires that organizations, that companies do these community benefits. And the Allston-Brighton Health Collaborative was one of several organizations included in this. There are tens of thousands of dollars on the line in what they're promising in community benefits. And community leaders think it's unlikely that any of that is going to come through in the years ahead, including that $15,000 a year scholarship, which, you know, sounds like a small amount of money when you consider the millions of dollars that's involved with something like Steward Health Care. But for the people receiving that scholarship, that's huge, and that's in the Allston-Brighton community. One thing worth noting is that even before this garage proposal, St. Elizabeth's did provide a lot of community support to the Allston-Brighton community, including to the Allston-Brighton Health Collaborative. And in previous years, it was out of the goodness of their heart. And as Steward took over, some of that started going away. You would have proposals like this hospital where they were required to give community giving, and they promised that money. And now we're seeing that that money might never come to these organizations.
The hospital has indicated to you, they're still saying, don't give up hope to these people, right?
Yeah, I reached out to the hospital for comment, and I heard directly from the president, Paul C. Smith, and he actually apologized in his statement, which I've heard from the Health Collaborative afterwards. That's the first time they've heard anything like that from him. He said he was sorry. He can understand why they feel that he and the hospital strung them along, and that he still plans to provide the money, and that the hospital still plans to build this garage and provide the other community funding. But as I said, given Steward's financial situation, community leaders and people on the Boston City Council who I've spoken to say they feel it's unlikely that this garage is going to happen and that this money for the community is going to come through.
I want to close by asking you, it's not just when it comes to the future and the consequences of Steward's struggles for this particular neighborhood, it's not just about charitable funding, right? It's also about the economic impact that St. Elizabeth's has in this area as a massive employer, right?
St. Elizabeth's is the largest employer in the Allston-Brighton area. So while this money for community groups matters a lot, an entire community's future is on the line. These are jobs for people who live in this neighborhood in Boston and a community that relies on St. Elizabeth's for health care, often low-income people who rely on it for health care. They've relied on it for decades, and there's a huge fear that given what's happening with Steward, and Steward, you know, has said that they plan to keep providing health care. They didn't give me comment on whether they plan to close St. Elizabeth's, which there have been reports that there are hospital closures coming. They plan on continuing to provide care. But for people in the community, for leaders in the community, there's a fear that the hospital could go away someday.
That's a lot to worry about, huge vacuum that will be left. All right, Jeremy Siegel, thank you. Appreciate it.
Thanks for having me, Adam.